Welcome back to Spirit Squared. I'm Andrew Darrington, your host. Tonight we're here at the Humidor, one of our key sponsors. We really appreciate their sponsorship and love doing the podcast here in this location. We want to appreciate, obviously, the Humidor, Rex Consulting, the Vault. We've got Hoot Holler, which is a great package store in Gun Barrel City. We've got Red Contracting. He does some cool 3D rendering, so if you ever want to build something or remodel something, 3D rendering is really where it's at. And then, let's see here. I think that's it. Rex Consulting, The Vault, Humidor, Hoot Holler, and Red Consulting. Thank you guys for sponsoring us. You guys really kind of help us upgrade our equipment and provide a facility for us to do these things, and also provide travel expenses and all that good stuff. So really, really appreciate you guys' support. Tonight, before I introduce my guest, tonight I'm having a little Tears of Lorena. If you've never had Tears of Lorena, it's kind of a boozy version of tequila. It's kind of a gateway for a lot of whiskey drinkers into tequila. And it's non-additive. It's a really, really good pour. If you've never had Tears of Lorena, I strongly recommend it. Our guest tonight is Kim Brown. Kim is a registered nurse and also an injector for Injectology2 here in Tyler. And great to have you on. Thanks so much.
Yeah, nice to meet you.
Yeah. So you're a registered nurse. You're working in hospitals. And what led you to injections and aesthetics?
Aesthetics.
Yeah. What led you to that?
So I've been a nurse since 2003. Long time. I'll let you do the math. So
yeah.
I did acute dialysis in a hospital setting, ICU, ER. After about 11, 12 years of that, long hours, long days, had a teenager at home. I just had an opportunity. An ER doc had talked to me about he was doing some aesthetics and some injections, and he was needing some help. So I applied and went to work for him, and he taught me everything about aesthetics and injections, and it went from there. I was always interested. I started actually a nursing career because I got bit by a dog when I was about 10 years old. Had to get about 20 stitches in my face, and I was left with a horrible scar, and I always hated that. So I always thought, plastic surgery, cosmetic stuff was always very interesting, and thought it could help people. So I've always liked it. But so as soon as I had an opportunity to jump into it, I did.
Yeah, very cool. And this was in Amarillo, right?
So I became a nurse. I'm from Amarillo.
Okay.
I went to Amarillo College and then West Texas A&M University.
Yeah. In Canyon, right?
Yeah. I'm a buff. Yeah.
Yeah. That's
Go Buffs.
I mean, I lived there for 5 years.
Oh,
so
you did?
yeah, I lived in Amarillo for 5 years.
Oh.
I worked for Walmart there.
Okay. Yeah.
And I was in Arlington, and they said, "Hey, we got a district position open," and shipped me over to West Texas, and I had all the way from Dumas, all the way to Lubbock, including Levelland, Plainview, all that good stuff. So, yeah, I can definitely identify. We lived on kind of the southwest portion of off Coulter.
That's where I lived too.
I can't remember the name of
Coulter and Soncy.
Yeah, I can't remember the name of the Woodland. Do they have woodlands there?
No.
I'm not sure, but it was a good neighborhood. I mean, it was a neighborhood in its own kind of thing. So
people are really nice from Amarillo. I didn't know there was trees in Texas until I came here for 6 weeks on an assignment. They wanted me to help open up. Chris has got the contract with the company I worked with, and I'm like, Texas has trees? Like, I thought Austin had trees, but Tyler has trees.
Oh yeah, for sure.
Yeah, and so I was here about 6 weeks, and I went back, and they called me like, hey, everybody loved you. They want to know, would you move here and work for? I said absolutely. So 6 weeks later, I moved here in 2011 and been here ever since.
As for 2012, I wanted to get here because my folks live in New Orleans, and my wife's folks live in Denton.
So you're in the middle.
So right in the middle, and her brother lives in Midlothian. She's got another brother that lives in Justin, and then my sister lives in Ruston. So it kind of puts us kind of in the middle of everybody. And we got to see a lot more family than when we were in Amarillo.
Yeah.
It was a long drive.
It is a very long drive.
And I'd never heard my eyes blink before when I was in Amarillo because it's so dry.
Dry and windy.
And then if you want to fish, you've got to drive, to Lake Meredith.
Yeah, and it's dried up 90% of the time.
Is it really? Oh my gosh.
Yeah, it's so dry down there, but yeah, Amarillo's very nice people.
Nice people.
not
windy,
a pretty town. Very windy.
stinks,
Yes.
smells like money, right?
Yes. When I was a kid, I'd be like, "What is that smell?" They're like, "Honey, that's the smell of money." And I was like, "Well, I'd rather be poor than." Of course, not now, but
Hereford.
yes, Hereford.
Yeah, for sure.
They have the pig farms and all the beef plants down there.
Yeah, for sure.
Yeah, so interesting.
Yeah,
I didn't know you
cool.
were from Emerald.
Yeah,
so.
well, I'm not from there. I
Wow,
lived there
that
for
you
5
lived
years,
there.
and it was a pretty long 5 years. It was very windy, but I agree. The people were super, super nice.
They are very
yeah.
nice.
So, what does the training look like to be an aesthetician? I can't get that word wrong.
You say a nurse injector, that's easy. There's an esthetician, and they do more like facials, chemical pills, dermaplaning, and then there's nurse injectors who actually inject dermal fillers and neurotoxins. Okay. And I've run lasers and I've done chemical pills and all that.
So it's not just a weekend, certificate you get, right?
No, they want you to have a nursing degree, and I've gone to so many master injections. There's a company called Allergan. They're the makers and owners of the Botox brand. Once you work for so long in the industry, they send you to these master trainings, and you take someone with you that have never had fillers or Botox, and you do an assessment, and then you spend 2 or 3 hours injecting, and they give you all the free products. So you actually get to have a lot of hands-on, and I've done 10 of those. I've actually gone to Miami and done trainings. I've gone to New Orleans and done trainings. So I've done trainings all over the U.S. with different physicians that are known, a lot of plastic surgeons, teach a lot of the injectable trainings. They have a cadaver course that I'm actually going to go to in Canada, hopefully in February. So they actually have people who have donated their body to science, and when you place the dermal fillers, you can actually place it on the cadavers, and you see the area that it goes into and make sure it's in the right area and where the vessels lie, because people think, oh, you're just going to get Botox or fillers, but it's actually a very serious thing. You have to know where the muscles lie. You need to know where the vessels lie, because if you have a complication, you need to realize that, and you need to know how to treat it quickly. And that's why a weekend course, it's great for people to learn, but it can be kind of scary for the patients that go there, the clients, because you're not always getting maybe safe care. I mean, I've been doing this 11 years, and I learn every single day something new. Thank goodness I've never had a vascular occlusion or complication, but I have a whole protocol kit in my office with Hylenex that you dissolve filler if it got into a vessel, which is like 12 vials, and you have a whole notebook protocol that you would follow, because you want to stop that quickly. You need to realize what's happening when it does happen. Someone that doesn't have a lot of experience or non-medical, they might not know that that's happening and maybe think it's a bruise or something else, and if it's not treated can lead to some very serious health complications. So things like that are important when you're looking for an injector. It can be a physician, a nurse. There's a lot of people who inject now who are like, maybe do lashes, and they've gone to take a weekend course, and it seems like everybody's offering courses because Botox and fillers are so popular right now.
Yeah, it's a big catchword.
It's kind of like going to get your hair done now. Like everybody's like, oh yeah, lip filler. I get lip filler, I get Botox, where it used to be kind of hush-hush. It's more mainstream now. People aren't embarrassed to talk about it or say that they get it now, so it's very popular. I think I was doing some research, and it was in 2021, 9 million Americans, they say, get Botox every year.
Wow.
That's a lot.
Yeah.
That's more than live in Arizona, so that's interesting.
What were some of we kind of conversed before this. What were some of the key learnings that you came across when you first got into the business?
So, like for instance, neurotoxins. There's a bunch of different kinds of neurotoxins. Of course, it started in the 1970s with a physician named Dr. Scott. He actually was trying to learn medically how to treat strabismus, or kids that were cross-eyed, and torticollis, which is where you cannot turn your neck. And so he came up with a medication that could be injected, and it would help relax the muscle so that the eye would straighten out, that the neck would, have more movement to it. And then they started realizing, hey, they're getting less wrinkles where we're putting this medication. Then came cosmetic Botox instead of medical Botox, and they started treating frown lines and forehead lines. So there's not a cookie cutter way of you come in and I'm going to give you the same Botox as I would give myself. Men and women are different. Everybody has different muscular movement. So it's not cookie cutter. It really needs to be designer. So I learned that in the beginning that, hey, it's not everybody gets 10 units in the forehead and 20 in the glabella. It's, you want to sit down, you want to ask what their goals are, how much money do they want to spend. It's very designated to that client. It's not just, oh, everybody's this and this is how much it's going to cost. So it takes a lot of practice and a lot of knowledge to get to that point where you can just look at somebody like, I have a bad habit now of walking around and I'm like, oh, they could use filler in their nasal labial folds. Oh, hey, that'd be 25 units of Botox in their glabella. It just takes a lot, just like someone who cleans teeth.
You're looking at my crow's feet.
Larry will tell you. He was afraid, my husband, he was afraid of injections, and I'm a big scaredy cat. I cannot inject myself. People ask all the time, do fillers and Botox surgery yourself? I do not. I have to get somebody to do it.
Sure.
But I do use a really good numbing cream, and then fillers have numbing in it as well. Botox, I use a little vibration device and ice, so I try to make it as comfortable as possible for people. So anyway, just knowing, and same with fillers, key learnings are you really got to learn where vessels lie and what to areas to stay away from, what is not to do, what to do. A lot of things that are popular right now are like liquid nose jobs. They don't have downtime where they need to go have surgical procedure done and they got black eyes for 8 weeks. They got to work and they don't have time to be sitting at home healing. So they'll come in and do a liquid nose lift. So you put filler in the nose to straighten it out, help with the lumps and bumps. It is a very particular because there's vessels that run through there, so a lot of people don't like to do it. It takes a lot of knowledge and a lot of skill. I do it, but I've been to 3 or 4 trainings and trained under some really great physicians for it. So things like that you can do instead of surgery. It's little to no downtime, less risk involved.
That's awesome, for listeners that don't know, I have had Botox.
Okay.
My sister-in-law is an I cannot say that word. An
aesthetic nurse.
Aesthetic nurse, yes, there we go. And Missy, shout out to you. And so I went into the office and she's like, yeah, you definitely need some work here. So yeah, I mean it's a pretty simple procedure and it didn't hurt at all.
Yeah.
I was pretty surprised.
We use a tiny little needle.
And I saw results immediately. And I think there was a little bit there wasn't any bruising, but you could tell like little spots for like maybe a couple hours.
Yeah, you get little, I call them little humps.
Yeah, and that was it.
Yeah.
So let's talk about patient expectation. Is it typically reasonable what their expectations are, or do you get some clients that are kind of out there, unreasonable, want to blur some lines, things like that?
Well, there's a couple of issues with that. So sometimes people come in and their budget's not very big. And filler can run anywhere from, if you're using FDA approved really good product, can run anywhere between, depending on the area of the state you're going to be in Texas. So like Dallas is probably going to be a little bit more expensive than Tyler, but so they want to spend a couple $100s and have a total facelift procedure with filler, and that just isn't going to happen. So budget plays a lot of role. I try to sit down with them, hey, kind of what's the budget, what area bothers you, these are the things under your budget, what we can do. Starting with skincare, medical grade skincare is one that's fairly inexpensive and really can make a big change in your skin. And people are like, oh, well, hey, I use something Lancome from Ulta, and I'm like, that's great that you're using anything. I mean, better than nothing, but medical grade is very small molecule, so it gets down into the dermis and actually does changes on your skin. Things that you buy, even though they're expensive, that you buy like at the drugstore that don't have a medical doctor over them, just kind of sit on the top of the skin, look good, feel good, smell good, but don't always do the changes that your skin needs. So medical grade, we talk about medical grade skincare because that's one of the least expensive things that can make changes in your skin. But and when I lived in Dallas and worked in Dallas, I would have girls with really huge lips that would be like, hey, I just need one more syringe. And not only is it medically scary to put more in because it can compress on vessels and cause blood flow not to go, but it also doesn't always look the greatest either. So a lot of times I would turn them down. They may go across the street to another injector, but I try to patient safety before money to me is big importance, and I want people happy. This stuff is not cheap. I want good results, good outcomes that's in their budget that they're going to be happy with. So I am less is best is my motto. You can always put a little bit in. You can't always take it out, or you have to let it wear off. And I think natural, like if you do Botox, you would want not someone, all your friends to be like, oh, hey, I see you got Botox. You'd be like, oh, hey, you look good. Did you get a haircut? Did you go on vacation? That's the kind of results I look for, not like overdone. So a lot of men are scared to send their wives to go get injections because they think, oh, you're gonna look like the Real Housewives. You have these big old cheeks and these crazy eyebrows, but it's not always like that. You can do it very naturally and very light, where it still looks very good, but looks like you just refreshed.
Yeah, for sure. Like a haircut, and a really nice haircut.
Yeah, I'd love for people to go, oh, no one noticed that I had anything done, but they said you look so good. What did you have done? That's to me the best compliment, because you don't want to be overdone. You want to look like yourself. You just not 20 years younger. I mean, that's a facelift. I mean, having Botox and fillers can just make you look like yourself, but like you had a great vacation. So cool. It's a great option for people who don't have the money to have surgical procedures and don't have the downtime and just not ready to go under the knife yet.
Yeah. All right. So we're going to get geeky a little bit here.
Okay.
Hey, podcast listeners, are you in need of some top-notch libations to elevate your next gathering? Look no further than Hoot and Holler Liquor Store in Gun Barrel City, your go-to liquor store for quality drinks. From smooth bourbons to crisp wines and everything in between, Hoot and Holler has one of the largest and most diverse selections in East Texas. Planning a special occasion? Let our experts guide you to the perfect bottle. You'll receive excellent customer service not offered in the big box chains. Visit Hoot and Holler today and let the good times flow.
If you are looking for a reputable builder with a proven track record and a client base to back it up, give Red Construction and Development LLC a call. Red Construction offers full design build services for new construction, custom homes, and remodeling with free site evaluations. They have an A+ rating with the BBB and are proud members of the Tyler Area Builders Association, Texas Association of Builders, National Association of Home Builders, and the Lindale Area Chamber of Commerce. Red Construction and Development LLC stands behind the exceptional quality of their work and have the expertise, the resources, and dedication to deliver the results you need on time and on budget. To learn more, give them a call at 903-630-8660 or visit them online at redconstructiondevelopment.com.
Because the most popular neurotoxin is Botox. Right? But there's more out there. So let's talk a little bit about some of those and maybe, are they used the same way?
They're used the same way.
Okay.
So Botox actually was found, it's a bacteria, it's botulinum toxin. In large amounts, it actually can kill you and make you stop breathing, and it's a paralytic. But in small amounts, like Botox or other neurotoxins, it just weakens the muscle.
Okay.
So a lot of people think that you inject this Botox and your forehead just lifts and it looks nice, shiny, and tight from the Botox. It actually
You're just slamming stuff in there. It's like pus or something.
Yeah. So it's a neurotoxin. Actually, I'll get nerdy for a minute.
Yeah, please.
So you have something called SNAP25, and the way I explain it to my clients is like it's a little bridge between the nerve and the muscle. The SNAP25 is what the Botox will actually kind of destroys it.
Okay.
That's why it takes a couple weeks for Botox to completely work, because it takes a while for that to break down.
Okay.
And that way acetylcholine, which is a neurotransmitter, can't get over into the muscle and cause a contraction. So the muscles that we inject with Botox tend to weaken because it can't get that acetylcholine into it.
Yeah.
The other muscles say, hey, you're being so lazy, why are you not doing your job? So they kind of overreact, and that kind of gives you the lift and the tightness and the nice shiny forehead, and your skin looks good. And then if you have creases in your skin from browning over and over, the Botox doesn't make that look, well, the Botox doesn't fill that in. Your skin actually says, oh, hey, we're not having a ton of movement, so I can actually fill myself in. So collagen and elastin fill in those little lines and make your skin better. It's not the Botox that does it. The Botox is just relaxing the muscle, giving the skin a chance to heal itself. and then you have overreaction from the muscles that you don't inject. So a lot of patients are not educated on how that works, and Botox is temporary, as you know.
Yep.
It takes a couple weeks to work. It lasts 3 to 4 months, depending on what kind you get, and then you have movement again. So some people are like, oh, once you get Botox, you have to keep getting it, or you get
Right.
more wrinkled. That's not true. You just have movement just like you would before you ever had it. Same with filler. You're not going to have this overinflated lips, and then once you never get filler again, they go deflated. They just go back to how they were once before. So, but there are different kinds of. Botox is kind of a slang term for a neurotoxin. So
Right.
just like if I was to ask you, hey, hand me a Kleenex, I don't want you to give me the name brand Kleenex. I just want you to give me a tissue
Right,
so
or
I can
Coke,
blow my nose, or a
or
Coke.
soda.
Yeah, so hey, give me a Coke. What do you want? Sprite,
Right.
Dr. Pepper. That's kind of how
Or
Botox.
Pop up north.
Yeah, pop.
Yeah.
So that's kind of how Botox is, but there are several kind. There are botulism toxins. There's Daxxify. It's more of a protein. There's Xeomin. It's a peptide. So there's different types. They basically do the same thing. Some work a little faster, stay around a little bit longer.
Okay.
But really, there's really no difference. They
Is
work the
Botox
same.
the cheapest option?
Botox
or?
is actually one of the most expensive
Okay,
options.
okay.
And it's just because it's termed Botox.
What is
I
it?
feel like.
Is there a determination that you make on which neurotoxin you're going to use?
I do. So if a 22-year-old came to me and never had anything before, I like Xeomin. Xeomin's a very purified protein.
Okay.
Very the most natural one of the neurotoxins that you can use. I like to use that a lot for my people who have never had it or not had it very much. You have your Botox fans who are tried and true. They've always had Botox. They want Botox. Jeuveau is kind of new on the market, and Daxxify. To me, technology, Botox has been around since the 70s,
Sure.
and it has not changed.
Yeah.
They say if it's
50
not broke,
years.
don't fix it.
Right.
But to me, there's new technology out there, new studies, and I love to use different neurotoxins that are newer just because it's newer technology. Or say you go to the gym and you do the same exercise over and over. You go back to the gym and try to do that, and your body's like, I know what you're doing.
Right.
You don't get a lot of change from it. If you do Botox for 10 years, your body's going to get used to it and not have a lot of change. It won't work as well. So you like to mix it up. I even tell people, change one time, use a different product, and if you like it, go back to Botox. Just give your body a break from the Botox and do something different. But yeah, so lots of different brands out there. They're all very similar. Daxxify is a peptide, and your skin looks really good. It's one of the newer ones out there, and it lasts, the longevity of it can last 6 to 8 months.
Nice.
So I used it for the first time maybe 6 months ago, and it lasted about 5.5 months, where Botox, I start getting movement 2 months, 3 months. So it's a little bit longer. It's a little bit more expensive because it is, it lasts longer.
Okay.
But it's one of the newer ones, and I do like to use it. Same with filler. There's a bunch of different types of filler. Hyaluronic acid filler is the most commonly used.
Yeah, I was just about to talk about, fillers was next on my list. But before we start talking about fillers, there's some medical use for some of these injectables, right? Like I've heard or read about headaches, maybe solving some issues with headaches or other ailments.
Yep, so a lot of neurologists will do, it's cosmetic, not cosmetic, it's medical Botox. So there's Botox cosmetic for cosmetic purposes and Botox medical for migraine. So neurologists will put in, whereas I may inject 50 units in you, they'll do 150, 180, 200 units for migraines all throughout the scalp. They'll put it in the traps for soreness and knots in the traps. They'll do it, it's cervical dystonia. It's where bladder spasms will actually go in and inject Botox into the bladder for people who have issues with that. Strabismus, they'll still use it for strabismus for kids who are cross-eyed. Torticollis in babies, they still use it for a lot of medical reasons. But yes, so there's 2 different types. It actually says on the vial Botox cosmetic and then Botox medical for medical offices that use it, like neurologists.
Yeah, very cool. I didn't know that about the bladder. That's pretty interesting.
Yeah, Botox is one of the only neuromodulators that actually can be used medically. They're the only ones FDA approved for medical use right now. I suppose that's going to change as more and more come out on the market.
Sure.
It's crazy though, because we'll get FDA approval in the US, and I have friends who inject, and nurse injectors that are well known, like in the UK, and they've been using this stuff for 20 years. It takes America a very long time to get anything FDA approved for use.
Unless it's a vaccine.
Unless it's a vaccine.
Right.
Then it takes 6 weeks,
Right.
four weeks.
All right, so you were talking about fillers. So fillers are different than neurotoxins.
They are. So wrinkle relaxers is what I call neurotoxins, or Botox, or Daxify. Volume. If you have volume loss, you want bigger lips, you want fuller cheeks, temple area, different nose, jawline, all that is fillers.
Okay.
I do want to go back and talk about Botox. Some people don't realize they think forehead, frown, and around the eyes, but there's so much more that you can do with Botox or neurotoxins. You can do a lip flip, make your lip look a little bit bigger because it relaxes the muscle around your lip. You can actually lift the tip of your nose with Botox. You can lift your jawline. There's something called to do your platysmal bands. It's called a Nefertiti neck lift because back in the Egyptian days, Nefertiti had the very nice, long, beautiful neck, so they've termed it Nefertiti neck lift. You do these platysmal bands in the jawline, so it changes the way your neck looks and helps lift everything. People who clench a lot or have kind of a fuller face or square face, you can put Botox into this big masseter muscle. It slims the face and it keeps you from clenching. I get that in mine, and it's 30 units each side, so like 60 units, a lot, but it lasts 6 to 7 months, and it will keep you from like breaking your teeth if you clench at night, and get it receding gum line. So some interesting things with Botox that people don't know, that there's a lot of different uses in the face for it. This is called a depressor angular oris muscle, and it turns the mouth corners down. So if you see the little old ladies shopping and they look really mad, that means they can't help it. This muscle gets tighter as we get older, and so putting a little Botox into this muscle will help relax that depressor muscle and lift it up so they look happier. We don't want them to look like the Joker, of course, but it can make a difference in that. So just some things with Botox before we move on.
Yeah, that's great. No, I appreciate you
because
asking
people
that.
just think, forehead, frown, and crow's feet, but you can actually, if you have advanced training, you can learn all the areas. If it moves, you can inject it, is what I say a lot of times.
Yeah, okay.
So, but for fillers, hyaluronic acid are the most common. They're the safest. Those can be dissolved with a medication called hyaluronidase or Hylenex. If for some reason you have a complication or someone just absolutely hates the way the filler looks, you can inject that and it will dissolve the hyaluronic acid. Hyaluronic acid, your body makes it naturally anyway, so it comes in a syringe. It's 1 cc, usually a clear gel. Place it underneath the dermis to give volume. There's different kinds of dermal filler, just like there's different kinds of neuromodulators. The thickness is different. It's a different company brand, so you have RHA, you have Allergan, Juvederm. Depending on where you're going to place it and what kind of look you're going for, that's how you would pick your product.
Gotcha.
Trying to think different ways that you can do jawlines, really popular right now. Chin, to build out people who have no chin, you can actually build someone out a chin with filler. A nose, you can do nose jobs, you can build out cheeks. Of course, the most popular is lip filler. All women want a little bit bigger lips. So, and you can do it very naturally, where if you have, some people do have very thin lips, so when they smile, your lip completely goes away. So you can put some in there naturally, where you can put lipstick on and your lipstick stays and it looks like you actually have a lip. I get a lot of women, especially older women, as you age, you lose that lip and that vermilion border, so they come just to get a little bit done in their lips so they can actually put some lipstick on. So.
Is it injectable? Is there a cost difference between filler and injections?
So Botox we do per unit. So say here, like if I was to inject you, I'd probably do 25 units in your glabella, and we charge per unit. So Botox at the clinic, I charge $13 a unit for Botox, and for Daxify or Xeomin, I charge $11 a unit. So when I get a neurotoxin on myself, I get about 70 units because I'm doing masseters, I'm doing around my eyes, I'm doing between my eyes. Filler is per syringe, and it runs anywhere from $600 to $1,000, just depending
the brand.
And so there's a Vicross technology, and that's how thick the filler will be. So if you wanted to do cheeks or jawline, you need a stiff filler to give that volume. If you're doing tiny little lip lines or you want just a little bit of a lip volume, you would use a very light filler. So that's also plays a role in cost and longevity. So a stiffer filler breaks down. Your body just kind of metabolizes it and breaks down the filler depending on how you metabolize things. Some people are runners and they work out a lot or lift weights, so metabolism's going to be a little bit higher. They're going to metabolize it a lot faster than someone who's sedentary and sits at a desk all day and types on a computer and don't get a lot of exercise. So, and some people naturally are just metabolizers of Botox and filler. So that's cost and where you're going to place it and what type of fillers based on where they need it. Do they need a thicker filler or a thinner filler? What kind of look are they going for? Like I say, I'm pretty conservative, but I have injected up to 8 syringes in somebody before. And that sounds like a lot, but it takes 5 syringes to make a ketchup packet. So it sounds like a lot, but it really isn't. You think one syringe really is not a lot of filler, and a lot of times, like on TikTok, they'll squeeze it out into a spoon and show you, hey, this is 1 cc of filler, and hey, this is 5 cc's of filler. So if someone has a lot of volume loss in their temples or their cheeks, it's not uncommon to use 4 or 5 syringes sometimes to get the volume replaced.
Are most of your treatments that you do in this nature, because you do a lot more than just these?
Vault Arms is your premier destination for all things firearms. Extensive selection of handguns, rifles, shotguns, and accessories. Knowledgeable staff to assist you in finding the perfect firearm to fit your needs. State-of-the-art gun range equipped with the latest technology for a safe and thrilling shooting experience. Take advantage of our professional shooting instruction and training programs suitable for all skill levels. Host your next group outing, corporate event, or bachelor party at our spacious and secure shooting facility. Committed to promoting responsible gun ownership and firearm safety. Fully licensed and compliant with all state and federal regulations.
Are you looking to optimize your drilling rig operations and maximize productivity? Look no further. Rex Consulting is here to power your drilling. With over 20 years of industry experience, our expert team provides tailored solutions that drive efficiency, safety, and profitability. From site assessments to cutting-edge technology integration, Rex Consulting is your trusted partner for land-based and offshore oil and gas drilling solutions. Ready to take your rig to the next level? Contact Rex Consulting today and send your operations to the next level in operational performance. Contact Josh Simmons at 918-637-9181. Rex Consulting, level up.
The Humidor is your online cigar retailing headquarters. Our experienced staff has spent years finding some of the best cigars from around the world to sell to our customers. If you're looking for an online cigar store that can help you find your next favorite smoke, welcome to the Humidor. We began the Humidor because of our deep appreciation of the finer things in life, a good conversation with friends, an aged whiskey, and, of course, a fine smoke. That's why, in addition to selling premium cigars online, we also operate a brick-and-mortar cigar lounge in Tyler, Texas. Our lounge is crafted to provide a classic ambience with modern sensibilities, and we've spent time ensuring that smokers and non-smokers have an enjoyable experience, whether they're there for a drink with friends or to enjoy the game.
But are you finding yourself sticking to one or the other, or are there tandem where maybe certain parts of the body you want to do injections, other parts you're going to do filler?
Yeah, it just depends. So say somebody comes with thin lips, but they have a low budget or they're scared of doing filler right now, we can do neurotoxin or Botox around their lip, or Daxify, and that'll be $100 versus a $600 syringe of filler, and it's temporary. Usually lasts 8 weeks. You use that your muscles in your mouth a lot. It wears off, and you're using very little units, so the cost is low and the effect is not going to be like if I got filler in my lips that would last 6 months to 9 months to maybe a year. So it gives them a chance, like, oh hey, I do like this, and maybe I will do filler when I get money or I get that bonus at work. So it's kind of a gateway drug. A lot of places use neurotoxins as to bring people in and like, hey, let's do a little Botox, and then when that gets fixed, they're like, oh, but I really hate the way this looks,
Right.
and what can I do for that? Well, hey, that's volume loss, so let's put a syringe of filler in there. So then you're doing things like filler and microneedling and medical grade skincare and lasers and all the things to make your skin look good. It's kind of, I always say, neurotoxins or Botox is kind of the gateway drug to the fillers and other things. But hyaluronic acid fillers are one of the main ones that people do because it's safer and can be dissolved. There are other ones, Sculptra and Radius or biostimulators.
Okay.
They're calcium based, so think of calcium as bone. They stick around longer, 5 to 7 years. If you have a complication or something you didn't like, there's no way of getting rid of them. Some people say you can use sodium thiosulfate, but really no, they're there until they get absorbed, which is a lot longer than hyaluronic acid fillers. So you're looking at 5 to 10 years probably. They're a lot more expensive.
Yeah, a lot more expensive.
And you need to be very skilled before you do those. I do some Radius and Sculptra. Sculptra actually was a medical biostimulator for people who had AIDS back in the 80s and 90s. So a physician came up with it to build volume for people who had AIDS and were really gaunt in their face, and now it's used widely in cosmetic. They'll even put it for BBL, so you can actually inject it into the butt to make a butt lift to expand volume in their rear. So they'll use a lot of Sculptra, or even
if they do a lot of sitting.
Or you're just a 50-year-old white lady like me that has no booty. You can actually put filler into the butt, or like things like Radius or PRP to actually build out. Or you get those little dips on the side of the hip. You can put filler in there too. I've had someone who got a steroid injection and had fat loss and had a big dent in their butt, and so I filled it in with filler because they still wore swimsuits and didn't like the way it looked, so we filled that volume loss in. So, but you want someone skilled that is doing that because, of course, it's going to be there for a while and it's expensive, and you want someone that knows what they're doing for sure, and not have just taken probably a little weekend class. It's a more advanced injection to do things like that. So
what is, you mentioned PRP. What is PRP?
PRP's getting really, people are wanting to become more natural now and do less and more homeopathic. So for the people that come in and say, oh, I have a lot of volume loss, but I really don't want to do fillers, PRP is great platelet rich plasma. So you sit them down in a chair, you draw out some vials of blood, you spin it in a centrifuge, the red blood cells go to the bottom, and this pure rich plasma with all these platelets are in the top. You pull that out and you can actually inject it for volume. Now your body will absorb some of it, and you need several sessions of it, but it's more natural. It's your own body. I do it a lot with microneedling. It's used to be termed the vampire facial, where it looked like you had blood all over your face. I think Kim Kardashian started that. It just heals the body, and a lot of physicians are like, if you're going to go and have your knee replaced, they'll do PRP, they'll draw your blood, spin it, and they'll have it ready to go during surgery, and they'll actually inject it into the joints for faster healing. So it just, your body heals a lot faster with it and produces more collagen and elastin, and it's just a more natural option.
Similar to a peptide, kind of? Or no?
Yeah, so they do peptides with that too. Peptides are becoming really big in the aesthetic world right now. But yeah, so it's your own body's fluid that just helps promote faster healing and can help produce more volume where you've lost it in the face without having to use fillers. So PRP's really popular, and we do a lot of it.
By the way, I was in the plasma industry for a while.
Oh, were you?
Yeah, I was a center director for a plasma donation facility. And so I've spun a few centrifuges before.
Have you? Plasmapheresis, we do that at the hospital.
Yeah, for sure.
When you're in acute dialysis, you do that a lot for people who have like Guillain-Barré. It helps take out the antibodies.
We didn't create medicines there, but we shipped our frozen plasma.
Make albumin and things like that.
Yeah, for sure. Drips, IV drips. I didn't see much of. I didn't interface with much of the finished product, but we did have patients come in from time to time to tell their story about they were immune deficient or whatever ailment they had, and then of course the sessions when you're dealing with that type of product are quite long, hour and a half, 2 hours when you're dealing with that type of medicine. But I mean, it was really rewarding for our phlebotomists and our the folks that worked in our labs, and to see somebody who's using it, and not only that, but it just raises awareness for safety issues. If something was kind of borderline, or maybe a donor had indicated they didn't have a tattoo within the last year or whatever, it raised our level, I guess. Like, hey, this is being injected in a human. How would you want your mom being treated? How would you want the person that you met last month, whoever that was, they bring a patient in, or we'd ask for a patient to be brought in, and they would tell us their story. And it was just an awesome kind of opportunity to see someone who takes a product that we were doing the sourcing for.
I went to phlebotomy school when I was 17, my senior year in high school, to help me get through nursing school.
Okay.
So I worked at a blood center.
Oh, did you? Okay.
And that's
cool.
where I started plasmapheresis. But when you do acute dialysis in the hospital,
Right.
we did plasmapheresis
Yeah.
then.
Yeah.
So I know all about
Yeah, for sure.
plasmapheresis.
17 gauge needles too.
Yes.
They're big pipes.
Yes.
So I got pretty good. I was there for about 4 years or so, and I got pretty good at phlebotomy, and I was even an instructor before I left.
Oh,
And then I
cool.
also did my own what is it called, first aid, like get certified and stuff like that. And so I did some of that with a couple of my nurses. So yeah,
You're a man of all
yeah, I spent a
trades.
little bit of time doing that. It was a fun time. It's very regulated, hard regulation.
As it should be.
While I was there, the facility that I managed got FDA approved, which was a very tough process. You had 3 doctors that come in, and it was about 4 days of reviewing your records, freezer manifests, and also donor files, and then what you did. So if a donor, you found out something happened, or if they got hurt, what was the process? How did you handle it? And that's kind of how they regulate whether or not they give you your certification. And then after that, we wanted to sell our products in Europe. So they have a German health authority that comes in, and it's one German doctor, not speaking a lot of English, loves coffee and loves high-end chocolates. So we had kind of an inside kind of, okay, let's make sure we get this guy comfortable. And
So you had a smorgasbord of dark
absolutely.
chocolates and coffees for him when
And
you
he
came
didn't
in?
eat anything else. For 3 days, he didn't eat anything with chocolates and coffee.
Wow.
But with the FDA, if they're inspecting you, they can't accept anything.
Yes.
But with the
Can't give
Germans,
gifts, yeah.
you could. So he like strong coffee. The strongest coffee I ever made was with this guy, and it was a much more relaxed inspection. With the FDA, I think I went through like 6 rolls of deodorant, and with the German health authority, just 1. So it was an interesting process, but it's interesting to know that that's something that your world is coming into, because you would think, yes, that seems like a reasonable treatment, is your own platelets and your own plasma being injected. It just makes a lot of sense to do it. It seems like it's a very, you're not putting anything foreign in it. So, I would 100% be for that, if you recommended it, obviously. Is it expensive to do?
It's
PRP?
actually a little bit, it's around what filler could be.
Okay.
So it's comparable to filler.
Right. But you prefer it in certain
Yeah,
avenues?
someone who doesn't want as much volume or wants more
Right.
natural, especially like tear troughs underneath the eye.
Yeah,
That's a very
yeah.
delicate area.
Yeah.
It takes a special type of filler to be put under there. It has to be non-hydrophilic because people already have bags. They don't want hydrophilic means water attracts to the molecule.
Yeah.
So you wouldn't want to use a hydrophilic filler and then they have these big water bags under their eye. So it just takes a special product and a really good injector to make sure that you get it smooth and even. Tear troughs and noses are the hardest to do filler under. So I do a lot of PRP for the tear troughs or underneath the eyes. That's a big problem in a lot of people, and it's just a lot safer to do PRP. I do filler as well. But it just depends on what the client wants. So with PRP, some of it is absorbed because it's
Sure,
your own
yeah,
body.
for sure.
Just like if you were to have a fat transfer, so you have to have several sessions of it,
Oh,
usually
yeah.
6 to 8 weeks apart. But I do have a lot of people that prefer PRP over filler just because it is more natural. Usually with filler, it's a one and done until, you know, your body absorbs it a year later and then you need more. So it's just kind of client choice and what they're looking for, and cost-wise is what I decide what we're going to do. The client plays a big role in, you know, what's their expectations, what are they looking for? They're looking, you know, for more natural, and then budget is what we decide what we're going to do.
You used a term earlier that I want to know a little bit more about. What is microneedling?
Microneedling. So microneedling, if I could only do one thing aesthetically the rest of my life, it would be microneedling. It's the only one thing I can do to myself. So
when you say that, it makes me think like of the eyebrow like treatment deal that people do with the
microblading.
Yeah, blading. It's what I think of. So, but it's not that for sure.
It's kind of similar. So I use a very good topical numbing medication. I leave that on 25-30 minutes. Clean the skin really, really good. You have a little pen. It looks like a little fat pen in it. You put a little, of course, for each patient, you have a brand new end that has these 12 to 16 little tiny needles. You can do the depth, whether the skin is very thick and you have a lot of volume, or you're on the forehead where there's bone right there and the skin is very thin. So the depth level is different and how fast it goes. So you microneedle the face and you make these small little micro trauma to the face, and it tells your skin, oh hey, something's happened here, I need to heal myself. So it creates more collagen and elastin for fine lines and wrinkles. It can create more volume, your skin looks better, the quality is better. Nothing really does that other than microneedling.
It's like a tattoo gun with no ink.
Yes, with no ink.
Gotcha.
You use a glide and you can do the whole face. Underneath the eyes, you can do the neck. You can do, so people who have had tummy tucks or have a really bad scar, you can do those and it'll help flatten, the color improves.
Awesome.
Yeah, so you can use it on medical purposes too for really bad injuries or scars, but I love it just because you can do it every 6 weeks or so. It's natural. It really stimulates the collagen and elastin to really keep building in your face, and it's my favorite treatment. I make my husband do it. He loves it. It helps with...
She's telling on you, Larry?
Yeah. It's the one thing when I'm pull the pin out and he's like, oh yeah, put the numbing on, like he'll let me do it, and it'll help with like sense damage. It's just really good to keep that skin healing and revived and looking fresh.
What's the cost comparison on that treatment? Is it less or?
Yeah, so it runs anywhere between $2 and $375.
Okay.
I like to pair it with the PRP, so I'll draw your blood, and as we're microneedling, I put the platelet-rich plasma on there and microneedle with it.
Okay.
And it creates faster collagen, better collagen. You heal quicker. So after you do it, your face kind of looks red, sunburnt, like you kind of had a wind burn. You don't want to put anything on the face for 2 or 3 days because you have all these tiny little holes until that heals up. You wash your face with cool water and some gentle face wash. Then that stimulation starts happening. After 3 days, you can put your makeup on, your sunscreen. So a little downtime, but really good results. I always tell my patients, if you never had it done before, do one, 6 weeks later, do another one, 6 weeks later, do another one, and then maintenance once a year. Every 6 months, do one just to keep
that quickly.
refreshed.
Okay, interesting.
Yeah, so my favorite treatment of all times is microneedling. Love it.
Right. So you guys at Injectology2 are the medical grade skincare. Talk to me a little bit about that. You have a doctor involved too, Dr. Adcock?
Dr. William Adcock. He's out of Frisco, anesthesiologist, and he does aesthetics as well. Love him. He's very knowledgeable, super sweet, but even though I'm a licensed registered nurse, you need a physician on board. Botox and fillers are a medication. They have to prescribe them. You have to get them through your physician to be able to administer them. You have to have protocols. You have to have someone deem that, yes, you are healthy enough and you can get a treatment done.
Okay.
It's called good faith exams. You need a physician or a nurse practitioner to do those. It's good for a year unless they have changes in their health. All those are safety, and it's great because you want a good, healthy patient that you're not going to hurt by giving them something that their body is not going to tolerate. Like someone who has Guillain-Barré or some kind of nerve issue, or you don't want to be giving them Botox, so they ask them all the medical questions. Now, I myself, being a nurse, ask them, do you have any infection going on? I do not do filler if they've had their teeth cleaned within 2 weeks before, and I tell them 2 weeks after, do not get a teeth cleaning or dental work if you can at all help it, or vaccines, because you're putting something foreign into the body, and if you stir up a lot of bacteria, or you have a process going on where the vaccine is trying to get in the body and keep you from getting a disease, you put filler in, it can just cause issues that you don't want. So I always say 2 weeks before, after, stay away from things like that. Not everybody does that, but I do, because I don't want anything to happen to my patients. So I go through like a health list, even though if they've been deemed 6 months ago that they can have filler. When they come in, they say they want filler. I make sure that they're good and healthy and don't have any issues going on and can get, the procedure done.
What is it about the cleaning that
It stirs up a ton of bacteria, and your body starts to go in and fight so that you don't get an infection. And if you're in an inject filler, it would say, hey, what is this? It can see as a foreign substance. It can cause what we call granulomas, or little hard nodules into the skin, or cause an infection. It's biofilm. You want the skin very clean when you're injecting, and you don't want any stimulation of bacteria or anything happening with like cleanings or vaccines. I'm very big on that. I clean the skin probably 20 times when I'm injecting filler, because you want a very clean surface. You're putting something underneath the skin that's going to stay in your body anywhere from 6 months to 2 years. So I consider it like an implant. I'm very big on being, septic technique and very clean, because I don't want my clients to have any kind of complications whatsoever. So
what's the regulatory body or inspection environment look like?
So it's actually gotten very strict, which I'm glad about, because now they have weekend courses in Dallas, and someone who does lashes can go take the course and find a doctor to oversee them, and then start injecting people without knowing, hey, there's a vessel that's right here, and if you inject, you could put filler in a vessel and it can stop the blood flow, and within 3 hours you're going to get necrotic tissue unless you reverse that. Nothing against lash technicians or anything like that. They just, I feel like they don't have the medical background to know vessels and health issues to do them safely. Like I said, it's a big deal to me. It's a serious thing. It's not just making your lips bigger. It's a medical procedure. So you want to make sure they're healthy and that you know what you're doing. And if you do have a complication like a vascular occlusion where filler gets into a vessel, you dang sure better recognize it, and you better know what to do with it, and very quickly, because it can cause blindness. They can lose tissue. I mean, I've never had one, but I've worked for dermatology and plastics for quite a long time in Dallas, and I've seen people come into the dermatologist who have had necrosis from having filler, and they have to have skin treatments. It can cause scarring, and it is very serious business, even though people treat it as going to get a haircut. It's a little bit more in depth than that. So I do tell you, if you're going to go somewhere, make sure they have an overseeing physician, make sure they're a nurse or a nurse practitioner, make sure what's their background, do they have a protocol if they have something happen that, of course you would never want anything to happen, but even the best injector, one day sometimes something that could happen no matter what, and you better know how to deal with it, or bad stuff can happen to your client. And we have to have liability insurance, have to have malpractice insurance. I have it on me and my physician in my office. It's a big deal. It's medical procedures that you're doing. So someone who cuts hair or does lashes, if you go to them, that's fine. Just make sure they have the background and knowledge to know what they're, what are they using. So it's not unusual for some people to say, hey, I'll do a $200 syringe of filler, and you're thinking that it costs me more to even get that. How are they doing that? And they're using something from overseas, like from Korea, called Sosom, that costs them $30 on the internet, that they just get mailed to them in their, mailed to their house. They're not going through a company that's reputable, that FDA approved and safe for your client, and you know exactly what's in there. It's listed on the box. It has lidocaine, it's hyaluronic acid. It's a big deal. So these legislative bills that are in place, make sure for patient safety that you're not just going to go down to a salon and go get filler and then something bad could happen. So they come in and they want to look at your protocols. They want to see your overseeing physician. They want to see, are you having good faith exams on all your clients? Are you keeping good records on your clients? Are you giving them, post-procedure paperwork that tells them what to do and how to follow so they don't get an infection? Rather than just run down and get some lip filler for a couple $100 and then you're out the door, and then something bad happens, you try to get a hold of your person and you can't get a hold of them. I give them my cell number. On their aftercare, they can call me 24/7, not just come into the office. Everybody I inject always has a way of getting hold of me 24/7, just in case something does happen. I want to be aware of it and get on it immediately.
Yeah, very cool. All right, so let's talk about your location. Your location's pretty new, right?
Fairly new. It's Shelton Development owned them, so there's a couple rows of offices over there. And actually, I've been there since May. When I was there, there's like 2-3 people over there. Now they're completely full, which is super cool. There's Gator Waiters.
Gator Waiters, yeah.
That was on your show. They're right next door to me, so I get to see those guys coming and going. They all have, I know exactly where they work because they all have the camouflage on, and they drive the big trucks. So
they all got hats on too.
All of them have caps
boots.
on. Yeah, and boots. So, and then we have a couple of realtors over there. We have a counseling place over there. Revitalize IV is over there. So we have some good folks over there. It's right off Old Jacksonville, kind of down by Fresh. We're the very last office, so it's a lot of privacy and really good parking on the left. 6713 Old Jacksonville Highway. We're in Suite 106. Great location. Shelton Realties, and they're so good. Great landlords to have. It's a very good location because Old Jacksonville is well known, well traveled. It's busy, and more things are popping up. There's
close to retail, close to grocery store, close to a really nice neighborhood.
Subdivisions, you have a lot of good subdivisions over there, and there's a lot of med spas around. I think there's one on every corner, it seems like. So I just go somewhere. They're professional, they're nice, they're going to educate you, they're going to show you that documentation that they're legit to be able to be injecting. Look at their before and after photos. Look at their reviews is another one. How long have they been in practice?
Yeah, I think pricing's another thing. Is if it's too cheap to be true, then it's probably not good for you.
Yes, you should question it. Now, everybody runs specials. Business gets a little slow, and those are okay to have every now and then. But if somebody is consistently $6-7 Botox, it costs injectors way more to even buy the product to inject it. So something's going on. I have a lot of clients that are like, oh, hey, I'm new to you, but I was going over here and it wasn't lasting or it wasn't working. I paid $300 and in 2 weeks, I had all this movement. So any kind of neuromodulator will come and it's freeze dried. You have to reconstitute it right before you inject the patient, before use to make it a liquid to be able to inject it into the muscle. So I've had people say, oh, they put liquid in it before they gave it to me. They were diluting it. I'm like, you have to reconstitute it to be able to inject it. But it specifically tells you how to reconstitute it. You use this amount of this product to put it into it to be able to inject it. So some people may, instead of 2.5 mLs, they may be putting 3 or 4 to make more of a product to be able to provide it cheaper, but you're not going to get the results. And you're not going to have happy clients, so why would you do that? I would rather charge, I'm not too high, I'm not too low. I try to stay, right in the middle, try to keep my overhead low so that I can keep prices reasonable so that everybody can be able to get this, like your nurses and your teachers and your businessmen, and not just the very wealthy, like it used to be back, in the 90s. So
so you opened this business in May. That's, the economy's not awesome, I would say. I mean, we did set records for Black Friday sales and stuff like that. So I mean, I think people just have been a little bit closer to the chest with their money. Have you seen any changes? I mean, obviously May, there's not a huge sample there, but business has got to be pretty good, right?
I'm lucky because I injected before and Tyler kind of already had a client base. I have a Dallas client base and they will actually get in their car and drive to Tyler to see me. So I'm very lucky that I already had established base when I opened the business. So I do stay steady. Now, has it been slower than what I would expect? Yes, but it's across the board. People that do hair and other injectors, we talk and share pearls, and we talk about how it's been slower, and I think it's maybe because it's an election year, the economy. I mean, groceries. Heck, you go get a basket of groceries, it's $125 where it used to be $45.
Right.
So, you know, everything's a lot higher these days. And, you know, I'm very appreciative of people that do come, because this is elective. You don't have to get Botox. You don't have to get filler. And it's an elective procedure, so that they would come and base their trust in me and spend their money that's not easy to come by these days makes me very appreciative to these clients that come to see me. And that's why I try to give them their best bang for their buck and do the thing that I think would give them the best results for what kind of budget they have, because this stuff is not cheap.
Sure.
And like you say, if it's too cheap, it's probably too good to be true, and you should be questioning them. How is it this cheap?
Right.
What product are you using? And it's your right to say, let me see your credentials, let me see your before and afters, and show me the product that you're using. So, like Botox actually has a little hologram on it, and you can get Botox from Turkey, but it's not FDA approved, and we really don't know what's in that, and you can get in trouble. It's illegal if they catch you injecting things like that in the U.S., but people do it because they can get it a lot cheaper. You get it from Allergan, it comes from the manufacturer, you get a packing slip, it has the hologram on it, so there's things to look for when you go to an injector to make sure you're getting the right kind of product. And don't be afraid to ask those questions. I'm never offended when somebody asks me. I actually will give them a copy.
Thank you for asking.
Yes.
If you're legit, I mean, thank you for asking.
You have nothing to hide.
Because
so
if you're combative or defensive, then it's a red flag.
Red flag, and run and go somewhere else where people have credentials. And, you know, sometimes I can't always get to Dallas to inject my clients, or they can't get here and they want to go to someone else. You know, I give you 5 names to go to, and I know these are all legit people. Their pricing's fairly reasonable. Their product is true, and they have the background medical knowledge to make sure you get what you need in the right way. So. And I never get offended. I mean, and if someone tells me, hey, I found $7 Botox, and I'm like, hey, go get it all day long from there, and if you like the results, because I can't give it to you for that, because it's more expensive for me to get it from the manufacturer, and you know, if you like it and you think it's good, hey, to do what you think you need to do, but I always try to use great product and, you know, reconstitute it the right way, inject it the right way, and follow all the rules that you need. But I'll be glad to see legislative change, actually, where it's more regulated, where not everybody could just inject if you feel like taking your class. It really is a medical procedure and needs to be done by medical people that have background knowledge.
Yeah, I kind of liken it to people ordering like the color contacts, and it's like those have to be prescribed. You can't just put that on your eye. I understand you want to look, you know, your eye look orange or, you know, whatever, and it may be good for one night, but people wear them all the time, sleep in them, all that kind of stuff, and you order them and they come like in a package, and it's a one-time use.
They sell them in cans. I've seen them sell them.
It's crazy. That should be illegal as well. And so hopefully they do crack down on that, because I mean, you're dealing with your body. And you're dealing with, like you said, a medical procedure. So it's very, very important. All right, so your business is fairly new. May. But you have something that's pretty fresh that you guys just got a new team member, right?
Yeah. So Courtney Stovall, her little company is called Injectology2. She's now in the office with me. She's independent, but she does really great facials. I'm talking like 2-hour facials, and she's very reasonable on her price. She does hydrofacials, chemical pills. She's very knowledgeable. She has 12, 13 years just like me in the business. She worked for Dr. Englebado in Plano for a very long time. She's from Troop, but she moved to Dallas just like me to expand and, you know, work for some plastic surgeons. So she's in the office, and we're so grateful to have her, because she's full of knowledge too. So yeah, so that's fairly new.
So you can add that, like if you get this done, and you maybe, okay, here's our menu. Our menu's gotten bigger now, and we're going to do this treatment. You said this was a sensitive area for you. We're going to do this treatment, and then I'm going to pass you over to Courtney, right? And she's going to do this treatment, and this is going to help you, and et cetera, right?
Yeah, you know, it's funny because people will come and get Botox and they'll get filler, but they never will use medical grade skincare, never get lasers, and I'm like, that's just like having a Ferrari, Lamborghini, and never getting it washed or polished. Like you just drive it around forever and ever and never wash it. Like you have this great thing and you've invested a lot of money in it.
Yeah,
you want it to look the best. You got to do, you know, A, B, and C. You can't just do A. Now you'll look okay with just having A, but to get your best bang for your buck, you want to do medical grade skincare. You want to get facials, get the hydrofacial. You want to get lasers. You want to do the whole thing to get your skin looking great.
Well, for me, it's something you said earlier was you want it to look natural.
Yes.
And if you get the one or two A and B or just A, then it may not look as natural as you want it to be. So getting the A, B, and C, maybe even D, is going to give you that totality of treatment that you need to maybe pinpoint the areas of concern, but make it look in its best manner, right?
Yeah, so say I have this shiny, tight forehead, and I have no wrinkles around my eyes, but I have these large sunspots and, you know, big wrinkles around my mouth. You're not getting your best bang for your buck, so get some medical grade skincare, get a couple laser treatments, get a chemical pill, use your, you know, skincare, and why not look your best? Why not drive your Ferrari around waxed and polished and all that? So I always kind of use that scenario with my clients, and I'm like, I actually discount my medical grade skincare because I'm not looking to make money off of it. I want my client to have the total package, and using that will just only enhance the results from their Botox and fillers. So I carry it because I use it, I believe in it, and I want my clients to be able to be on it as well. So, you know, a lot of people market way up and like, oh, I have all this great skincare, and it is good stuff, and it is a little bit more expensive than your drugstore, but it's medically driven to go down in that cellular level and get you some real changes, not just your skin look good for the first hour and then it kind of slips off. It actually goes down in the dermis and does changes and helps fight free radicals and help take the layer of skin off and slough off the old dead cells and let the new healthy cells come forward. So I'm a big believer in doing A, B, C, and D, like you said, possibly, to take care of your skin. And people come in and they feel bad and want to, oh, this, you know, costs a lot, I need to hide from my husband. I'm like, your skin is your largest organ in your body. Don't feel bad for taking care of it. I mean, we got to wear this face for hopefully 80, 90, 100 years. Why not have it at its best health? I mean, you're really getting your skin healthy. People are like, oh, toxins, you know, you're putting toxins. You're not. I mean, using it medically, you're just having your skin look the best and having it healthy. You know, keeping that top layer of skin healthy will make you look better and, you know, keep it intact, less, you know, infections, and make you feel good about yourself. You know, I've had people come with Bell's palsy and one side of their face, you know, has been paralyzed, and they're, you know,
my wife has it.
Does she?
Yeah, she had Bell's palsy. She doesn't have, I mean, I guess it kind of wears away. It's
Some
temporary.
people can have effects for,
but I mean, it comes and
temporary.
goes. So like, she doesn't like smiling that much, or doesn't, you know, like taking pictures and things of that nature. But and then of course, you know, we all have our favorite side, you know, type of thing. So she picks her side, you know, that she wants to take pictures on and stuff like that. So
yeah, so I've had clients come in with Bell's palsy that's lasted, and they're like, I'm so droopy, I hate to even get out. Like, their self-confidence is just ruined, and that's what I really love being in this industry. I've worked some places and they want you to sit the client down in front of a mirror and tell them all the things that's wrong with them, and I'm like, I will never do that, because why would I mention something to you that you may never have thought about, and then I just put another thought in your head. I sit the client down, I'm like, you tell me what you don't like or you would like to maybe change or enhance to look better. I never try to bring up things. Now, if I see something and like, oh, this kind of bothers me with this, I'm like, yeah, you know, you could put filler here. I suggest things, but I never just sit down and like, you would leave there feeling horrible. You know, everybody has lots of things that they could fix. I mean, I could do injectables on myself all day long and there's going to be something, my nose, or, you know, that I don't like, or a line that I sleep and I can't get rid of. So I try to have the client leaving feeling more confident than when they came in, and like, everybody has a great feature. Their eyes, or really good lips, or really good cheekbones, and we try to enhance that great feature by, you know, maybe putting a little bit here in the lips, and now they have these great cheekbones and they feel great because they have these, you know, great nice lips to go with it. So just enhancing your beauty and making you feel more confident is what I love about my job. You know, sometimes I get sad because people come in and like, oh, I look horrible, and I'm like, no, do you realize you have really beautiful skin?
Right.
They're like, do you think? I'm like, I see skin all day long. Like, your skin looks really great for a 55-year-old woman. So people, I just try to say, hey, are these cheekbones, like, hey, I have women in their 20s that come in and try to recreate these cheekbones, and you have really great ones. You know, be happy that you have great cheekbones, and okay, this area bothers you. Let's, you know, we can do a little enhancement to make this match these, and you feel better. So that makes me happy when they are like, hey, you know, I hated this, and now I can look in the mirror and I'm like, oh, you know, I'm really loving the way I look right now, and feel, you know, more confident and have more self-esteem. So.
Yeah. So with it being a medical procedure, before we get to shout-outs, because that's going to be our last segment, since it's a medical procedure, I would assume that like HSAs are approved for the most part. Or is it considered an elective procedure?
It is considered elective.
Even if you have a doctor that says yes, that, you know, this is something I see that you need, it's still considered elective.
So IV therapy, I do some IV therapy now. Some insurances will pay for IV therapy or health savings.
Like rehydration?
Rehydration.
Okay.
So they'll allow that.
I didn't know that. Okay.
So
that's great.
Yeah, they'll allow that, and you can use your health savings card. But if you just go in and get lip filler and you put on your health savings, I can put it on there. But they might say, hey, what was this for? And have to produce a receipt.
Right.
So. Sometimes it works, sometimes it doesn't.
Okay, just depends on the company.
Just depends on the company and what HSA company you're using.
Yeah, for sure.
Just
thought I'd ask.
I have Christus Insurance, and I have health savings account, and I mean, they ask about every medication I pick up from the pharmacy. They want to see a receipt. To each his own. I say I will try it for you, but they may kick it back and want you to produce a receipt. But like, if you had Bell's palsy or something and you're trying to fix that, they would maybe more likely to okay that.
Yeah, if you see your PCP and then go from there. Yeah, that makes sense. I use a phototherapy patch, and my HSA covers it, which is pretty cool. I had a really bad golfer, like tennis elbow, golfer elbow, whatever, and I was kind of at my wit's end. I didn't really know what kind of treatments I could do, and I did a little research, and it's helped me a ton. Started doing the patches, and within 10 days I could tell a difference.
Really?
Yeah, I was wearing like an elbow brace, because I lift a couple times a week just to try to stay healthy and young, try to beat down time, and I was having to wear a brace, and it got so bad that I couldn't sleep on my right side, and it was really painful, and it started at an elbow and went all the way to my shoulder, and it felt like it was in my joint. It hurt so bad, and so I didn't really know what to do. I talked to my doctor, and he kind of suggested a couple things that I didn't want to do,
like surgical.
Yeah, or go to a therapist, you know, type of thing, and I didn't really want to do that. So I just kind of was like, hey, you know, I'll try it, see what it is. And I have a friend that's kind of in that business and promotes it, and tried it. It's been amazing.
Really?
Yeah, I've worn it for about 4 months now, and I don't have any pain. It doesn't, and when I lift, it doesn't hurt, which is awesome. I don't have to, and I haven't worn a brace since. So it's amazing what technology's out there, and it's a peptide.
It's a peptide.
Yeah, for sure, a topical peptide.
Exosomes and peptides are really popular in the medical and cosmetic field right now.
All right, it's time for shout-outs. It's my favorite part.
Yeah, so you
Well,
can say,
I mean, it's been really cool talking about this, because I had Missy, my sister-in-law. I had her scheduled, and then we had, unfortunately, that side of the family had a medical event, so she had to cancel. And I'd done a pretty good amount of research, you know, just kind of learning a little bit about what you guys do, and I think it's amazing what you guys do. I think it's really awesome.
It's a fun job. I still work the hospital because I like to keep my skills up, so I still do acute dialysis and ICU and do some ER because I don't want to lose that.
Yeah,
but
for sure.
I love this industry. I love this job, so I want to, you know, I would like to keep doing both. It makes it kind of hard, but
shout out to aesthetics. Now I've got the word.
Aesthetics.
Yeah, here at the end.
So there's esthetician and aesthetics. So aesthetics is kind of a hard word, but aesthetics are all thing cosmetic.
Got it.
So aesthetics, so shout out. So you keep saying, oh, you started in May when the economy was bad. My husband, we've been married 2 years now, and ever since we've been together, he's like, you just need to do your own thing, quit working for people, quit helping other med spas, do your own thing. And I'm like, oh, COVID, it's not a great time, or the economy. And he just kept on and kept on, and that little office actually opened up, and someone had told us about it, and there had been an injector in there before, so the setup was great. And so we talked about it, and he's like, you just need to go for it. I'm like, all right, let's do it. And so we were remodeling 3 bathrooms in our home and opened this med spa all at the same time. Yeah, so it was a little stressful.
Might as well just do it.
We just did it, just pulled the Band-Aid, just did it. So, but it's been great, and got to know people in Tyler that I didn't know with new clients, and going to different events. We're since we have a business out now, small business events. We're with the Chamber of Tyler Chamber of
Rotary
Commerce.
Club, all that stuff.
Yeah, so it's been great to meet new people and get to know more of Tyler, and
get in on podcast.
and then I have the greatest clients, and a lot of our friends have come to see me to help support the business. So great group of friends, great set of clients that I've had that I've been injecting since 2013. So 11 years that they've been seeing me, and still stay true and trust me and keep coming. And
did you have any mentors in the process?
I did. So I worked for Dr. Max Stewart at Pure, and so that's where I kind of got my start, and he got me really excited about aesthetics. And then I got to really learn when I went to Dallas, because they kind of do some interesting stuff down there that's kind of off-label, and I got to go some really great training. So that's where I really perfected, I think, and really got to learn, oh, hey, you could really do this and this, like the jaw lines and the nose job. So I admired him. He was an ER doc, and said, he was tired of the politics at the hospital and started injecting, his kitchen on his wife, and kind of dabbling in it, and he learned he really loved it, and he could do his own thing. And so when he brought me in, I think I trained under him for at least a year, and we got to do bioidentical hormones and lasers and all kinds of fun things, and made me fall in love with aesthetics.
Awesome. It's been a blast.
Yeah.
Thanks so much for coming on. I really appreciate it. You don't seem nervous.
No,
you know the stuff inside and out.
Yeah, I guess because I talk about it all day long to clients.
For sure. Well, thanks so much for coming on.
Yeah,
really appreciate it. Yeah, for sure. All right. Well, that is our episode with Kim Brown. And I really appreciate you coming on. It was really fun learning all the things about aesthetics. And best of luck on your business, too. Really hope that you prosper there and have a great time, and treat those patients, and they flourish from the treatments. And hopefully people that are listening don't just go with A or B, go with the whole program. And like you said,
and do your homework before you go to wherever you go to. Even if you don't come to me, just make sure that you're going to a reputable person with reputable products. So
very cool. So our next podcast is going to be back at home. We started our podcast at Beckham Hotel there in Mineola. Looking forward to being back there. We've got our second, or she's been on before, and she's coming on again, Shannon Hood. Looking forward to having her. She's going to be coming representing Iron Root, which is a very popular whiskey brand here in Texas. So looking forward to that. So thanks so much for listening. Have a good one. Awesome. How do you think it went? You like it?
Yeah. What about you? You're the expert in all this.
I'm an expert.